Injury fracture. This complex fracture had occurred after my patient had slipped and awkwardly landed on their kneecap patella while celebrating. This had caused a fracture across his whole patella bone. Injury treatment scenario. Firstly, I had seen my client laying in agony on the floor. I had assessed this by going over which then I looked and had talked to my client and came to the conclusion that my client had hurt his knee. Therefore, I asked my client how and what happened. I then had tried to move my client's leg, however was unable to do this due to the severity of the injury. After this, I stretchered my client off the pitch. Furthermore, at the hospital, I referred him to the X-ray team, in which they came back with a complex fracture. This injury will mean my client will wear a brace with crutches in order for stability, as well as enabling my client to be mobile, with the brace preventing further damage. Right, I will tell my client to rest for 12 weeks in order for the fracture to heal effectively. After this, I will use ice in order to reduce inflammation and swelling. I will not use any compression, as this may cause further damage and more internal fractures. I will tell my client to elevate their leg just above heart level in order to reduce swelling and inflammation. This will be diagnosed by an X-ray. Treatment. Treatment will be a brace with bandaging. This will keep the patella stable whilst also enabling mobility for my patient. I will refer my patient to an orthopedic due to the ligament damage as well as a complex fracture. The orthopedic is great as it will enable my client to carry out manoeuvres successfully as well as being able to recover in a quicker period of time. After this, I will also prefer my client to a physiotherapist in order to rehabilitate, which will increase strength and movement of the patella. Injury, dislocation. During a head injury in football, a player had fell over awkwardly, landing on their shoulder, in which had led to a dislocation of the ball and socket joints. Injury treatment scenario. Soul taps. I had seen my client bend over holding his shoulder, and then assessed this by going over and clearing the surroundings. I had then asked my client if he had felt any pain, in which he replied, "Call the hospital, I'm in agony." I looked at the patient's shoulder and clearly seen the joint disconnected from the socket. I touched my client's shoulder and had felt the joint unattached to the socket. I had told my client to try and lift his arm, however he was unable to do so. Therefore, I decided not to be passive and let the doctor put it back in place, the ball and socket back in its place. I then put my arm around the client and managed to place him in the ambulance. Right. I'll tell my client to rest for a period of 6 weeks. Ice will be applied in order to reduce inflammation and swelling. I will not use any compression as it will be unnecessary to do so due to the pain and unnecessary action. I will not tell my client to elevate as he may cause further injury. Only the doctor may tell my client this when he wants to pop in the ball into the socket. This was diagnosed by a doctor when the doctor had clearly seen the ball disconnected from the socket. Treatment. This will be treated by an arm sling in order to stabilise the arm and not cause further damage, however, also increase recovery time. I will refer my patient to a physiotherapist, which will help my patient build up tissue around the ball and socket to prevent permanent damage of the ball and socket joints. Injury, torn Achilles. This devastating injury was caused when a player had jumped to control the ball in mid-air, however landed in an unusual position and unfortunately torn their Achilles. Soul taps. I see my client limp to the floor. I assessed this by seeing my player shouting in agony. I looked at my client and tried to see the injury, however could not see due to the socks covering the injury. I then had touched my client's Achilles and clearly felt the torn Achilles, so therefore I came to the conclusion that my client may have torn their Achilles. After this, I asked my client how he felt and where it hurt. However, I had figured this out due to my client screaming that what he supposedly done. My client felt agonizing pain. I did not be passive with my patient, as I had clearly known that it caused further damage. I had stretched my client as he was unable to walk and was in excruciating pain. Right. I will tell my client to rest for a period of 2 to 6 weeks depending on the severity of the injury, however enable them to be more mobile after this and give my client crutches and a tendon support with bandage wrapping in order to enable the tendon to recover effectively. I will apply ice for 10 minutes as it may reduce inflammation and pain. I will not use any compression as this may cause further injury and pain. I will not elevate, as it will be unnecessary to do so. I will touch the Achilles in order to find out whether it's torn. This is done by a doctor squeezing the calf muscles and seeing if there is a flex in the Achilles. If not, unfortunately, the patient has a torn Achilles. Treatment for this will be an Achilles support and crutches. However, my client may not need further support after 1 to 3 months to enable more movement and strengthen the tendon. I will refer my client to a physiotherapist, as this is the most useful source of treatment post-surgery. This will involve rehabilitation and manoeuvres of the tendon which will enable my client to recover effectively. Concussion. Concussion is a type of brain injury which is caused by an impact to the head which causes the brain to move and result in impairments of the senses. I will tell my client to rest and not do vigorous exercise, as it may cause further damage which may permanently affect the brain and sensory neurons. I will tell my client to completely rest for 24 to 72 hours depending on injury severity. I will also discuss with my client that he should not return to football for at least 2 weeks. After this, I will apply an ice pack covered with a towel to my client's head injury. This will reduce inflammation and swelling from the head. I will tell my client to apply ice every 15 to 20 minutes for every hour. This will ultimately help to recover the injury quickly and effectively. I wouldn't use any compression, as this may influence more brain damage. I would not use any elevation, as would be unnecessary to do so, as it may influence more blood pressure to the brain, which may influence the possibility of nosebleeds, internal bleeding, etc. I will diagnose concussion by referring to the MRI, CT scan, which may give a definitive answer. Also, I may do a cognitive skills test, which may determine how severe the concussion injury is. Soul taps. I had seen my client laying bewildered on the floor. I had assessed this by my player's lack of communicative skills towards the sideline. I had asked my client how he feels and what hurts. However, my client had a lack of understanding. Therefore, I proceeded with the look and touch stage, where I had seen a gash on the right side of his head. I did not touch this, as my client's senses may be affected due to my I then asked him whether he felt sick and where he was and how many fingers I had held up. When my client didn't feel sick, however, he felt dizzy and couldn't count how many fingers correctly. After this, I was passive and lifted my client up. However, unable to do this, he felt lightheaded and dropped back to the floor. Therefore, I gave permission to the team to bring out the stretcher and take him to hospital urgently. Treatment. For this treatment, I will apply ice and take tests with further observations. The tests will be included of cognitive exam tests. I will refer my patient to the GP. This will enable my patient to suggest his feelings and progress. The GP will assess my client by doing eye tests and further examinations. This is great, as it enables monitoring of the patient to assess the injury and severity.